ABC7 I-Team has a startling number to report. In Chicago and the suburbs during the past year, the number of people who died from drug overdoses was about 1,500, significantly more than the number of fatal gunshot victims. Eyewitness News investigative reporter Chuck Goudie joining us with the details. Chuck?
Alan, the deadly data is driven mostly by opioid deaths, overdoses from heroin and fentanyl, the super painkiller that's become a favorite of drug abusers. A total of about 1,500 overdose deaths in Chicago and the Collier counties compares to less than 1,000 gunshot murders. Drug figures based on preliminary records and data projections collected by the ABC7 I-Team. There were 112 overdose deaths last year in Will County alone, 82 of them from heroin and fentanyl, according to coroner's data, figures higher than the previous year. Lake County numbers also up, at least 80 deaths now confirmed from all drug overdoses, up from 46 the previous year. The numbers would be even higher, according to experts, were it not for the widely used emergency overdose treatment known as naloxone that is carried by paramedic crews and some law enforcement throughout the area. Naloxone saved several hundred lives in 2017 and may explain why DuPage County's numbers held steady in 2017 at 95, the same overdose death count as the previous year. Cook County will actually end up with slightly fewer overdose deaths, according to a spokesperson for the medical examiner, after skyrocketing since 2015 and peaking at nearly 1,100 in 2016. Authorities tell the I-Team that last year in Cook County there were 1,002 overdose deaths, according to preliminary figures. But with more than 300 deaths across the suburbs last year, local county and state health officials and police agencies in Illinois have begun mapping out efforts to curb the opioid epidemic, from task force operations to hotlines and addiction crisis centers. Even as the overdose antidote naloxone saves lives, it has become a friction point in some communities where law enforcement tell us they have received complaints from taxpayers about the use of public resources to save drug addicts, some of whom have told medical officials they continue to use opioids knowing that emergency responders carry the treatment that will revive them. Some glimmers of hope in the data, but still an incredible problem.
All right, Chuck, thank you.